Our project topic is non-invasive blood glucose monitoring system. Non-invasive methodology is a process in which people don't use the traditional methods of needle piercing or taking blood samples to measure the glucose level in their blood to check for sugar or diabetes. Non invasive blood glucose monitoring uses a method which is based on the principle that glucose molecules absorb light in the near infrared spectrum. When a red light sensor is placed on the skin, such as like this one, the light penetrates the skin and the underlying tissues, and some of it is absorbed by the glucose molecules in the blood. By measuring the amount of light absorbed, it is possible to determine the concentration of glucose in the blood. One of the most common non invasive methods of glucose monitoring is using red light sensors, and it's called transdermal optical glucose sensing. Here we would like to present a small demonstration of the same. This method uses a sensor that is placed on the skin, usually on the fingertip, and measures the amount of light that is absorbed by the glucose molecules in the blood. However, it is important to note that the accuracy of these kind of non-invasive blood glucose monitoring using red light sensors is still being researched and is under development. While it is also promising alternative to traditional invasive methods for glucose monitoring, such as the finger stick test, etc., available in the market, it is always best to consult with a healthcare professional for advice on the most appropriate method for glucose monitoring systems for any individual needs. Now, I'll show you the demonstration about how this product works. One more thing, we have used the minimal number of products in our hardware because using the minimal number of products helps in making the overall 3D model a more compact way. So, this is the code that we used. A detailed version of this will be given. And to start, this is the red light sensor, this is the Arduino microprocessor, and LCD 16:2 display, and HC04 for transferring the data from this to an IoT device. So I am placing my finger here. You could see that my glucose level is 130, and in serial monitor also we are able to see this. A glucose level of 130 is approximately normal for a person who has had their food before 2 hours. And since I had my food before 2 hours,